Well, very good evening and welcome to hashtag tracking COVID-19. I'm Abhishek Mahajan. In the next half an hour, we track all the national and international developments on coronavirus outbreak. With Buddh Purnima being observed today, Prime Minister Narendra Modi participated in the virtual Vesak global celebrations and delivered a keynote address. We'll give you all the details on this. Also, under the Vande Mataram mission, Indians are being repatriated from UAE. And in addition to this, in a mega operation, the Indian Navy's INS Jalashwa reached Maldives to bring back Indians stranded on the island nation. All of this in the next half an hour, and also scientists at CSIR have come up with the cheaper diagnostic test which would deliver results to patients within 30 minutes. All that and more. First up, the headlines. India begins biggest evacuation exercise Vande Bharat mission, 64 flights and 3 naval ships to ferry around 15,000 Indian citizens back from 13 countries in a week. 2 flights depart from Kerala while INS Jalashwa enters Malé port for the first phase under Operation Samudra Setu to repatriate Indians from Maldives. In an exclusive interview to DD News, Union Civil Aviation Minister Hardeep Singh Puri said the aviation sector in India will be opened in a phased and calibrated manner. Domestic flights will be made operational, keeping in mind the overall condition. Flights from Abu Dhabi to Kochi takes off with 177 passengers and 4 infants, distressed workers, pregnant women, elderly people on board flight. Other people also being contacted for flights to different destinations. PM Modi participates in the virtual Vesak global celebration, salutes the Corona warriors around the world for working around the clock to serve the humanity during coronavirus pandemic. Coronavirus cases across the world rise over 37 lakh with over 2,63,000 deaths reported so far. US President Donald Trump describes coronavirus pandemic as the worst attack ever on the United States with more than 73,000 deaths in the country so far. Death toll in United Kingdom crosses 30,000 mark. Well, let's start with our top story. Prime Minister Narendra Modi today participated in the virtual Vesak global celebrations on the occasion of Buddh Purnima. PM Modi extended praise for observing this festival as Prayers Week, dedicating it to health workers and other such people fighting COVID-19 pandemic world over. He also expressed hope that we will be able to bring humanity out of this tough challenge and reduce problems of people with coordinated efforts.
बुद्ध वो है जो स्वयं को तपाकर, स्वयं को खपाकर, खुद को न्योछावर करके पूरी दुनिया में आनंद फैलाने के लिए समर्पित है। और हम सभी का सौभाग्य देखिए, इस समय हम अपने आसपास ऐसे अनेकों लोगों को देख रहे हैं जो दूसरों की सेवा के लिए, किसी मरीज के इलाज के लिए, किसी गरीब को भोजन कराने के लिए, किसी अस्पताल में सफाई के लिए, किसी सड़क पर कानून व्यवस्था बनाए रखने के लिए 24 घंटे काम कर रहे हैं। भारत में, भारत के बाहर ऐसा प्रत्येक व्यक्ति, विश्व के हर कोने में ऐसा प्रत्येक व्यक्ति अभिनंदन का पात्र है, नमन का पात्र है।
Well, Prime Minister Narendra Modi assured that India stands strongly with the world in these times of crisis. He added that this is the reason that many countries remembered India during the pandemic.
आज आप भी देख रहे हैं कि भारत निस्वार्थ भाव से बिना किसी भेद के अपने यहां भी और पूरे विश्व में कहीं भी संकट में घिरे व्यक्ति के साथ पूरी मजबूती से खड़ा है। लाभ हानि, समर्थ असमर्थ से अलग हमारे लिए संकट की ये घड़ी सहायता करने की है। जितना संभव हो मदद का हाथ आगे बढ़ाने की है। यही कारण है कि विश्व के अनेक देशों ने भारत को इस मुश्किल समय में याद किया और भारत ने भी हर जरूरतमंद तक पहुंचने में कोई कसर नहीं छोड़ी है। भारत आज प्रत्येक भारतवासी का जीवन बचाने के लिए हर संभव प्रयास तो कर ही रहा है, अपने वैश्विक दायित्वों का भी उतनी ही गंभीरता से पालन कर रहा है।
Right, in terming Buddha as a symbol of both realization of India and self-realization of India, PM Modi said India is working in the interest of the world and would continue doing so for the humanity.
बुद्ध भारत के बोध और भारत के आत्मबोध दोनों का प्रतीक है। इसी आत्मबोध के साथ भारत निरंतर पूरी मानवता के लिए पूरे विश्व के हित में काम कर रहा है और करता रहेगा। भारत की प्रगति हमेशा विश्व की प्रगति में सहायक होगी। साथियों, हमारी सफलता के पैमाने और लक्ष्य दोनों समय के साथ बदलते रहते हैं, लेकिन जो बात हमें हमेशा ध्यान रखनी है वो ये कि हमारा काम निरंतर सेवा भाव से ही होना चाहिए।
Always work with a sense of service, that's what he said. Moving on, the biggest ever evacuation exercise by air and sea route has begun to bring back around 15,000 Indians stranded abroad under the Vande Bharat mission. 64 flights between 14 Indian cities and 12 foreign countries will bring back 14,800 people in the first phase, and the first Air India Express flight to the UAE to evacuate Indian citizens stranded there due to COVID-19 pandemic left at 12:15 p.m. today. So these are the visuals of the Dubai airport where the passengers are waiting to board the flight for India, and Dubai to Kozhikode to be precise. Now let's listen in what the passengers said before boarding the flight.
3 weeks. On June 20th is my due date. I applied registered in Indian Embassy for consulate. Everybody is very cooperative to us. Anytime we call and ask questions, they will definitely answer those things. They are frequently calling and asking our passport, tickets, everything.
Thank you, India government and the embassy, Morka, Kerala government, everyone. Thank you.
And now let's hear what Consul General Vipul, who is leading repatriation operation in Dubai, he had to say. Let's listen in.
All the things are being done in a very orderly manner, and everyone is very happy that they are going back. Of course, these have been very difficult time for all of us in the pandemic situation, but I'm happy that now some flights for India are resuming, and in this flight we have 177 passengers. Many of them are pregnant ladies. We have lots of Indian workers who are in distress. We have the elderly people and lots of medical cases, and some of the stranded visitors who would have come to meet their family or for tourism purposes. And I'm happy that people are going back safely.
So, shortlisting the first passengers from among a database of more than 2 lakh applicants, who include around 6,500 pregnant women, has been a mammoth task which posed several challenges for the missions. Now, these are the visuals of the Abu Dhabi airport of the distressed people being repatriated. So, medical screening is being conducted before the final departure. So, Ambassador to UAE Pawan Kapoor at the Abu Dhabi airport spoke to passengers before they took the flight to Kochi. Let's listen in what he said.
Very lucky to have the support of the UAE government, their Ministry of Foreign Affairs, their Civil Aviation Authorities, and of course their Department of Health, who are conducting tests here today before the passengers board the flights. Even in India, it's been a whole of government approach to this. We've had our Ministry of Civil Aviation, our Ministry of Health, our Ministry of Home Affairs, and of course our Ministry of External Affairs, who all work together to make this start. And we hope that if this process carries on smoothly, both at departure points and at arrival in India, we'll be able to carry this on, adding on new destinations and places, try and meet the needs of more and more people who want to go back urgently.
And not to forget, on Monday, the Indian government announced plans to begin a phased repatriation of its citizens stranded abroad from May 7th. The government also said that Air India will operate 64 flights from May 7th to May 13th. Moving on, under the evacuation exercise, Vande Bharat mission INS Jalashwa reached Maldives' capital Male for evacuation of Indian nationals to carry out the first phase under Operation Samudra Setu. The evacuation will repatriate Indians from Maldives and will leave for Kochi tomorrow, carrying around 700 Indians. However, only asymptomatic passengers are allowed to travel and will be quarantined if required. Moving on, Air India will be operating special flights from 8th May to 14th May for foreigners who are stranded in India due to COVID-19 lockdown. The special flight tickets are available for sale now for people who need to go abroad. The nationals of the destination countries, Indian and foreign nationals who hold valid visa of at least 1 year duration of the country of destination, green card or OCI card holders can book their tickets from India to London, Singapore and select destination in USA. The entire cost of travel will be borne by the passenger. So, this is a very important point. And in yet another breakthrough to help India's coronavirus testing, scientists at the Council for Scientific and Industrial Research, which is CSIR, have come up with a cheaper diagnostic test for the coronavirus that can deliver results to patients within 30 minutes. Named after a fictional detective character created by Indian filmmaker Satyajit Ray, Feluda is a paper-based test strip developed by a group of 7 scientists at a lab in CSIR in New Delhi. The test uses a CSIR PR-based approach to diagnose COVID-19. The paper strip has 2 lines, a control line to check if the strip is functional and a test line which appears if the case is positive. CSIR Director General Shekhar Mande said that test kit was 3 to 5 times cheaper than the RT-PCR testing kits, and Feluda also takes lesser time. Mande said since Feluda does not require heavy machinery, it can be used for rapid mass testing across India. CSIR has also tied up with India's Tata Sons Group to commercialize and put the kit into widespread use in the country by May end. Moving ahead now, in West Bengal's Kolkata, several more containment zones have been identified in the city as the coronavirus cases continue to increase, with around 500 beds dedicated to COVID-19 patients in Kolkata Medical College. Our correspondent from Kolkata reports on the same.
318 containment zones has been found out itself in the city Kolkata. Police administrations are keeping eye on the Naka checkings and other checkposts so that gatherings and other things can be avoided, chaos can be avoided in the city. As the relaxation concerned, the timing of the shops has also been increasing in the non-containment zones areas and other green zone and orange zone areas. As today's recent development or the major concern is like 500 beds has been dedicated to COVID-19, has totally dedicated to COVID-19 patients under Kolkata Medical College. Administration assured that in recent coming days more testings will be done for COVID-19 patients. This is Momita Biswas for DD News, Kolkata.
So this was our report from Kolkata. Moving on, our correspondent Shyama Mishra reports over coronavirus situation from Mumbai. Let's hear her.
A major development came in from Mumbai yesterday when the total number of positive coronavirus patients crossed the 10,000 mark. The numbers are also rising in the slum area of Dharavi, where today the total number is more than 700. This calls for more and new initiatives that are being undertaken, and 3,000 beds for quarantine institutions have been created where more than 2,400 people are admitted and being treated. Around 350 clinics have started working in the particular area. Even dispensaries have opened up, and people are urged that if they feel the symptoms of COVID-19, they should get themselves treated. Because of this, early detection is possible today. We are also seeing central team today visited the Dharavi area, and the last time when they visited, more and new initiatives were suggested. Every day we are seeing some of the other initiatives are being taken to arrest the spread of COVID-19 in the slum area. Shyama Mishra, DD India, Mumbai.
So this was Shyama Mishra's report from Mumbai. Moving on, a Bengaluru-based nanotechnology startup has come up with an innovative device named Corona Oven, which uses the help of UV light rays in disinfecting virus from any surface. It can help in sanitizing masks within 10 minutes and other medical equipments, groceries as well. Our correspondent Aisha Khanam brings us this special report.
Coronavirus has given loads of reason for inventions to take precautions against this dreaded virus. Now, Bangalore being the capital of startups and technology, it is no surprise that the Bangaloreans have come up with a wonderful equipment which kills coronavirus at the entrance level itself. A Bangalore-based startup, Log9, has come up with a disinfection chamber. Now this is called the Corona Oven. Now when you talk of oven, you remember the oven which we use in the kitchens, and this is almost the similar size and similar weight of the oven which we use in the kitchen. But this is the Corona Oven, built by the startup company, and this is built on the nanotechnology. Because this is a chamber which kills the virus using the UV rays. Now when you enter offices or when you enter homes and place any equipment in this oven, in this chamber, it uses the nanotechnology. Now you can see for 10 minutes the nanotechnology is activated. The ultraviolet rays are now killing the virus on the surface of my mobile phone. So it requires about 10 minutes for the equipment to be cleaned and disinfected when it is kept in this oven. The Bangalore-based startup says that these portable ovens, Corona Oven, can be kept in homes, offices, or anywhere wherein they can kill the virus at the entrance itself. So this is Mr. Bharat, the inspector of Kaban Park Police Station in Bangalore here, who uses this oven every day. Bharat, how useful is this for the police people who are taking advantage of this?
You know, we have given instructions to all the police members to sanitize all their equipments once they enter the police station, wherein there should be no virus in any of the materials what they are having.
So all the policemen know?
Policemen, including their slow charts, the caps, the phone or the keychains, and including the masks, we are sanitizing.
So is it effective?
Yeah, it is effective. It has been scientifically proved now, so that it is very effective.
So most of the police station in Bangalore is now using Corona ovens. Now these ovens can also be used to sanitize masks and PPE also. Now with the shortage of masks and PPE coming up, this kind of technology, the nanotechnology, can be utilized wherein the chambers can be built with larger and bigger size and used to sanitize these equipments. Aisha Khanam, DD India, Bangalore.
So, Union Health Minister Dr. Harshvardhan and Ayush Minister Shripad Yesso Naik jointly launched 3 Ayush-based interdisciplinary studies related to COVID-19 situation in New Delhi. The 3 interdisciplinary studies include clinical research on Ayurveda interventions, population-based interventional studies on impact of Ayush-based prophylactic interventions, and Ayush Sanjeevani application-based study for impact assessment of acceptance and usage of Ayush advisories. The outcome of the study would certainly pave a new horizon in understanding the preventive potential of Ayush interventions during pandemics like COVID-19 through scientific evidence. Health Minister emphasized on importance and usage of Ayush to cure disease.
चाइना में ये कोविड-19 वायरस का प्रकोप शुरू हुआ, बाद में हमने अध्ययन करने की कोशिश की कि चाइना के लोगों ने अपने लोगों के लिए क्या किया, तो बहुत स्पष्ट रूप से ध्यान में आया कि उन्होंने अपनी जो ट्रेडिशनल मेडिसिन्स थी उनका भरपूर प्रयोग किया अपने कोविड के मरीज़ों के ऊपर। हम लोग कभी कभी हमारी जो अपनी चीज़ है उसको इस्तेमाल करने में सोचते रहते हैं, संकोच करते हैं, लेकिन उन्होंने ऐसा किया। फिर इस अवसर पर मैं ये भी बात स्मरण कराना चाहता हूँ कि कई बार लोगों को ये मन में रहता है कि शायद जो मॉडर्न सिस्टम है ये आयुर्वेद का विरोधी हो सकता है। तो मैंने तो वर्षों वर्ल्ड हेल्थ ऑर्गेनाइजेशन में काम किया आयुर्वेद के बारे में, और आयुर्वेद से जुड़ी हुई जितनी भी ट्रेडिशनल नॉलेज है इसके बारे में विश्व स्वास्थ्य संगठन में भी उसी प्रकार से डिस्कशन होता है, उसी प्रकार से निर्णय होते हैं, उसी प्रकार से पॉलिसी होती है, उसी प्रकार से जो होना चाहिए, कैसे सारे सिस्टम्स का इंटीग्रेशन होना चाहिए, कैसे होलिस्टिक अप्रोच होनी चाहिए, कैसे सबको मिलके काम करना चाहिए, ये सारी चीज़ें वहाँ पर होती हैं।
Now let's take a look at some international news now. Here's a graphical representation of the COVID-19 outbreak in different countries. Well, moving to international stories now, Russia is hosting a meeting of health officials from BRICS countries to discuss the coronavirus pandemic. The 5 countries jointly account for at least 430,000 cases. Our correspondent Lucy Taylor reports from Moscow.
This is a meeting of senior health officials from those BRICS countries: Brazil, Russia, India, China and South Africa. And they're going to be discussing the response to the coronavirus pandemic and share their experience of how it's affected these individual countries, because of course they're all at different stages of the outbreak. Russia, which is officially hosting this meeting, is very keen to push the mechanism for developing vaccines jointly. It's something that these countries have discussed before in previous meetings in previous years related to other illnesses. But now with the coronavirus pandemic, Russia is keen to get that back on the table and get these 5 countries working together to develop a vaccine and to work out a way to put that into use. Recommendations that come out of this meeting will be put forward to health ministers later in the year. This is one of a number of meetings which would be hosted here in Moscow, but as it happens, they're being hosted online, of course, because of the restrictions of the coronavirus pandemic.
And that's a wrap on this special broadcast. But news continues here on DD India. You can catch all the latest updates on our social media, mobile and digital platform. Thanks for watching. Bye-bye.